Hello viewers, Minor Care cares for you, and that is the reason every week we go to various doctors trying to understand various ailments and how best we can take care of ourselves. On the occasion of World Arthritis Day, we had come to Batra Hospital to talk to Dr. D.K Gupta, Senior Consultant and Head of the Department at Batra Hospital. We will try to know from him what are the causes of arthritis, how we can take care of ourselves, and what is the way forward if we have one. Over to Dr. Gupta. Dr. Gupta, thank you for your time. Sir, what is arthritis?
Arthritis means, itis means inflammation, and arth means joint, inflammation of a joint. There are many types of arthritis, and there are probably more than 100 reasons for arthritis, including one age factor, autoimmune diseases. Some people have even blamed infections, viral things, some many unknown causes, because autoimmune is a huge complex of many things, and every different type has a different type of way of investigations coming to the conclusion, as well as the treatment varies according to the type of the arthritis.
Sir, it looks like that there are very many reasons why arthritis might happen, but are there any specific reasons that you see which are very common?
Arthritis is a huge group, contains both inflammatory as well as non-inflammatory diseases. Now, in our country, world over actually, one of the main reasons for osteoarthritis, which is age related, is the weight, excessive weight, plus some concern about the bad postures, some concern about the type of the diet we take. They cause early arthritis. Of course, then there are genetic factors, familial factors, which do lead to a lot of type of arthritis. Even in osteoarthritis, which is a age-related disease, the genetic factor, family history, they can affect the person. And as well, in autoimmune diseases, of course, there is a little more incidence of family history. And now, diet, particularly when we are talking of diet, is junk food, deep fried things and things which release free radicals in the body, and those free radicals are definitely known to be affecting the cartilage of the joints, and hence affect the joint cartilage and the knee, the joints overall. Now, other types of arthritis, like autoimmune diseases, autoimmune disease means when the cell of the body does not recognize the body cell as its own. It considers it as a sort of an enemy and hence starts attacking, and that leads to autoimmune complexes, which lead to which are taken up by the white cells of the defensive cells of the body, which cause vacuoles, release some enzymes which are destructive for the cartilage, and the cartilage goes on getting destroyed, and hence the joint gets destroyed.
So thank you for giving us that insight. Going forward, what are the signs and symptoms that a common person should be aware of to understand whether arthritis is setting in, and how would they know what are the signs and symptoms?
First of all, we must understand the types of arthritis. There are a lot of types of arthritis where it is the crystals which are causing deposition inside the joint, inside the synovial joint membrane and articular cartilage, and they destroy the cartilage like gout, like pyrophosphates, calcium pyrophosphates. They get deposited in the cartilage and they destroy the joint. The other type, inflammatory type, are like group of autoimmune diseases like rheumatoid arthritis, which is the most common, which seems to involve 1 to 3% population all over the world. And it seems to involve nearly 8 to 10% population after the age of 65. It destroys the articular cartilage by growing granulation tissue, and the joint becomes so painful, so inflamed because of the autoimmune disease. The antigen-antibody reactions. Antigens are produced itself by the variants of IgG, as well as they are taken up by the fighting cells, lymphocytes, and then the release of enzymes. What lot of enzymes are there, which they don't need to go into detail, are released, which destroy the articular cartilage. And once the articular cartilage destroyed, the joint is gone.
So, sir, this is something which is happening internally. Externally, how would I know? Is it only joint pain which gives a signal, or is it something else?
Initially, talking of osteoarthritis first. Initially, the person will start feeling pain off and on. As the disease progresses, then they start realizing that when I do some activity for say half an hour or whatever, and then after that the pain persists in the joint for more than 15-20 minutes, that means the disease is advancing a lot. And then once the cartilage is destroyed, the cartilage is sitting on a subchondral bone which gets thickened up. There are some, nature tries to do some repair, and hence osteophytes form as a reparative mechanism, but away from the area of the function, which is not useful. And hence go on, the cartilage as destroyed, the joint space goes on reducing till the bones are denuded of the cartilage and they start rubbing against each other. And that's when the patient is incapacitated. Once the disease advances further, they start getting even night pain. They can't sleep. They get up in the middle of the night with a severe pain. And that is when the neglected case,
right,
where the person has not taken care of or may not have sought some early. In early stages, a lot of things can be done. But once it is delayed, then there is nothing else except surgery.
So human tendency to overcome pain can actually aggravate the disease going forward.
Yes.
So
yes.
Understanding from what you were saying, then it becomes critical for an individual to understand the pain and immediately consult to a doctor to understand and relate more.
This was about osteoarthritis, but talking of rheumatoid arthritis, initially the pain person feels off and on, bad, low, fatigue and things, and because it's a generalized disease, it's a systemic disease, it's involved the whole body, even the lungs and the kidneys and a lot of them. Then they generally feel handicapped, particularly in the morning stiffness, which lasts anything more than 30 minutes is very significant. Anything less than 30 minutes could be psychological. But then the person, that is the time when the person needs to see the doctor, consultant. A lot of people think that rheumatoid arthritis and variants, because there are a lot of variants of rheumatoid, they uh, have no treatment. A lot of people think that there is no treatment, but actually, in fact, if the treatment is started in proper time and earnestly, 60 to 70% people at least can be stabilized or even cured, and till the disease burns itself out.
A stitch in time saves nine.
Yes.
Sir, while you have been explaining very lucidly what happens inside, so medically how do you diagnose and what are the kind of treatments which are available today?
Once the patient comes, first of all, we have to go into the history. What is the patient's problem? What is its functional capability? How much is the, for example, osteoarthritis? We always like to know how much is the patient able to walk. Is he able to walk comfortably? Is he not able to walk even 100 meters? While in rheumatoid arthritis, the problem is entirely different. The young lady, a mother, finds that she is suffering from rheumatoid or autoimmune diseases, find that she in the morning cannot get up from the bed and cannot prepare the children for school, cannot prepare the tiffin for the children. And it's because of the morning stiffness, she finds difficulty in moving her fingers even, cannot make fist. So this is the time when the patient earnestly needs to get the treatment done properly, which I find a lot of people go on ignoring. They will try all kind of medicines at home and different. I'm not saying that alternative systems of medicine don't work, they do, but one has to be earnest follow it.
So, sir, what kind of medical treatment do you administer to somebody who has come?
In again specifying osteoarthritis, we do not need to treat very extensively, but just to make the patient comfortable. First of all, if the patient is obese, we have to tell them to cut down the weight, because for every 1 kilogram weight, the patient is putting 4 kilogram on the knee. If somebody weighs 70 kilo, that means there are 280 kilo on the knees, and similarly on the hips. While when they go upstairs, downstairs, it can, depending on the speed, it can go to 5 to 6 times. While running and jogging and jumping and dancing even, how vigorous dancing, it can be anything from 7 to 8 times. So every 1 kilogram lost, weight lost, at least reduces the load on the knee by 4 kilogram. So we tell them to reduce 40 kilo, at 10 kilo you will reduce, your knees will reduce 40 kilo. My professor in England, he used to say, knees are the young sons, they carry you for the rest of the life. In present times, if your son goes to the doctor along with your mother or father, you are lucky. If it doesn't go, what can you do? You can't do anything. And that's what is happening in the present times.
That was an excellent anecdote, sir. So coming back to the scenario in India, what are the common forms of arthritis in India?
Osteoarthritis is more common in India. Rheumatoid, which is the next type of arthritis, which is very incapacitating, is next common. But there are many more types of arthritis. I mean, every arthritis has different genesis and different treatment and different type of modulation.
Right. So coming to the gender specific incidence, is it possible for us to identify certain arthritis with the male gender and certain arthritis with the female gender? Is it something like that, or is it that any gender might be affected by any type of arthritis?
Osteoarthritis, particularly of the knees, is more common in our country in the women compared to the men. Maybe bad postures, maybe a lot of women sit on the floor, squat on the floor, to some extent, as far the medical science goes, even the squatting position and even cross-leg position, they can aggravate arthritis, as far the science goes. And while in rheumatoid arthritis, again, the incidence is a little higher in women compared to the, and it is more common in second, third decade, and then after 60.
So you've already mentioned obesity as one thing which people need to take care of. At this point in time, on behalf of our audience, I would really like to know what kind of lifestyle do's and don'ts we should adopt to take care of our health in terms of arthritis.
As I mentioned earlier, diet is a very important thing. 2, weight reduction is a very crucial issue. 3, shoe wear. We will say, to put it in layman's term, there should be shock absorbers in the shoes. If I weigh 80 kilo, when I put my foot down, Newton's law of gravity says there is a equal and opposite reaction from the earth. Mother Earth puts 80 kilo back, and that 80 kilo passes through the knee. Can we neutralize that? So, if we can have some kind of shock absorbers in the shoes. Shock absorber, naturally you can't have shock absorber. Basically, idea is to understand you have soft spongy shoes which absorb the impact.
So interestingly, fashion is also going to have an impact.
Yes.
So we need to understand that as well.
Yes. High heel, stilettos, they are, of course, they have the genesis in it.
So on the occasion of World Arthritis Day, what would be your message to our audience? You have been in this field for quite a long time, and if I am not mistaken, you are one of the most renowned, most qualified on the subject. What would be your message to our audience?
Again, I will say, whenever you have problem with the joints, as I mentioned earlier, arthritis means, itis means inflammation, arth means joints. That means synovial joints, bigger joints like knees, even fingers, wrists, elbows, shoulders, hips, ankles, they all synovial joints, they get involved. Whenever you have a problem, try to see the doctor. And basically, essentially, idea is to get to a diagnosis. And how do we diagnose? One is go through the history. 2, examine the patient. 3, we do blood tests, imaging like X-rays, and if need be MRI, CT scan if need be, and sometimes we aspirate the fluid from the joint to check it, to check for biochemistry, check for type of the cells in it has, because septic arthritis, that is infection, arthritis caused by infection, can be very, very fast deteriorating, while osteoarthritis is a slow and serious process, and rheumatoid arthritis is initially, it may come and go, but it is a persistent disease. It goes on. How long the rheumatoid arthritis patient need treatment, nobody can say. 6 months, 6 years, 10 years, nobody can say how long the person is going to, till we have to control the disease. We have to keep the disease under control so that it doesn't destroy the joint, because it doesn't cause deformities, till the disease burns itself out. In fact, I had a line there. We believe that it is the OPD population, OPD consultation, people come for referral, people come. 20% population is because of the musculoskeletal problems only.
So on behalf of MinorCare and on behalf of all the audience we have, I really thank you from the core of my heart for sharing your knowledge on the subject, and I'm sure all our audience are going to benefit from it. Thank you so much, sir.